Good morning. Oh, good afternoon. Oh my goodness, it's so light outside. So yeah, hello everyone. My name is Sunny Chen. I'm an associate professor in the School of Nursing and Healthcare Leadership. And who are you guys? Can you tell me which classes are you from? Okay. What else? Anyone want to share with me?
I'm from Pierce. I'm not even from this place.
Oh, nice meeting you. Thank you for joining us. Yeah.
I've been through nursing school.
Yay, thank you. And how many of you are from I overheard there's a psychology class. How many of you? Great, awesome. Great. It's my pleasure to be here with you all today. And I'm going to share an exciting update about my ongoing collaboration with Multi-Care Behavioral Health Network and Tacoma Public Schools. And 2 years ago, I also joined this presentation to talk about how we initiated the partnership with these community partners. And thanks to the substantial support from Office of Community Partnership, we have been able to expand our efforts with our community partners. So today, I'm going to share with you the School Nurse Training Initiative. So this is the overview of the history of my work, funded by the Faculty Fellow Awards. And it's all around addressing school youth behavioral and mental health concerns. And my approach has always been that we build work around what the community needs, not what I want to, to intervene. So I have a question for you all. Before 2022, and what do you think that led us focus on the school, youth, behavioral health, and mental health projects? What do you think? Before 2022, what led to us? What led to the beginning of all these projects? Do you have any idea?
COVID.
Yes. Who said COVID? Great. Yes, you guessed it right. So because of COVID. So the pandemic really created a surge in mental health crisis among young people. And with many have been brought into the ER in Mary Bridge Hospital. And I remember there were over 400% increase in youth who struggle with mental health crisis. And that was a really critical moment, and Multi-Care reached out to our School of Nursing and Healthcare Leadership for guidance on how we could collaborate in addressing the mental health crisis. And thanks to the generous support from OCP, we were able to develop the initial partnership to take meaningful steps forward. I also want to take a moment to recognize my mentors, Dr. Garner and Dr. Wilgerat, whose mentorship has been invaluable throughout this journey. And since we started this partnership, we've provided over 22 psychiatrist-led consultations, and we reached more than 500 participants, primarily school counselors. So some of you are in school psychologists, and for school counselors and school staff who care for students' well-being. And we have trained over 50 students and 5 instructors in mental health first aid training. How many of you heard about mental health first aid training? Good. Can you tell me what it's about?
I've taken it like almost 3 years ago now.
Great. Yeah.
But, the mental health first aid talks about the youth and suicide.
Yes.
And, how to manage it.
Yes.
That if one decides to suicide, that's a thing.
Yes.
We don't call it anything else but that. And if they decide to do that, if you're there with someone, it is not on you.
Yes.
That's a choice that they make.
Yes.
But it is into prevention, intervention, and so on and so forth. So.
Great. Yeah, it's to recognize the early warning signs and encourage youth to seek for help to the adults. And we teach them the skills to seek for help. Great, thank you. And all of these efforts really paved the way for the project that I'm going to share with you today, the School Nurse Initiative. So thank you, OCP. Really appreciate the support. Without the support, we couldn't even begin the work. So for school nurses, they spend 1/3 of their time focusing on mental health, and they have shared with us that they need more resources to support the students in this area. And one thing I've learned through the community engagement work is how powerful it is to involve those who we serve from the beginning. So after several community meetings, we identified 2 key phases for the initiative. First of all, we conducted qualitative interviews and surveys, so we call it mixed method studies. And we pinpoint the specific areas where school nurses felt that need more training. And we selected school nurses from different age group of students that they serve, as well as those who could help us guide us in ensuring that the training will be practical and feasible for school. It's really important to get a buy-in from the community partners. So through this needs assessment, we identified 5 key topics for the trainings, including crisis intervention and mental health communication skills. And we also identified the learning objectives under the training, each training. So under each training, we want to provide practical and evidence-based information to help them to know how to identify and address those mental health topics that they want more resources on. We also share with them how to do the assessment, and most importantly is what are the policies that can guide their practice. And we also learn about their preferred format of the training. Surprisingly, rather than doing a full-day workshops, they as suggested in evidence-based guidelines, they really prefer shorter and in the sessions in the morning before they start to see the students. So based on this feedback, we launched a series of 5 training sessions last year, focusing on these 5 key topics. We also evaluated how well the training made their needs in terms of knowledge and confidence, and also accessibility. So we actually have over 50 participants, but we only implement this survey in the end of these 5 trainings, and there were 15 people who responded. And this is the overall demographics from these school nurses who help us to have the data. So the findings really, highlight the acceptability and feasibility of providing school nurses with targeted mental health training to enhance their competency to promote mental health in diverse and multicultural student population. And my collaborator and I will present these specific project results in April in the Western Institute of Nursing Conference. It's in Spokane though, so it's not, Spokane, yeah, but not in Portuguese or other European countries. Yeah. Of course, like the previous group mentioned, none of this would be possible without our incredible collaborators, those healthcare providers, and also who believe the impact of this work, and the dedicated school staff who work tirelessly every day to nurture students' mental well-being. But as we all know, this work doesn't end here. So looking ahead, one of the biggest challenges or opportunities, we say, is the sustainability. So we really want to advocate for the scientific findings from these projects so we can secure the resources needed to continue and expand this important work. Another important area for future exploration is how we define and understand cultural differences in mental health. So we found that most times when we talk about culture, what comes to your mind? Culture. There's no right or wrong answers. Just the first thing that came to your mind.
How you live.
How you live, that's great. You have very good cultural competence. Yes. But, yeah, go nursing. But, go ahead.
Maybe like the set of traditions, values, instilled by, whatever community is around you.
Yes, that's great. I have goosebumps hearing you say that, because a lot of the time we define culture as where they are from, like their race and ethnicity. But there are a lot of cultural nuances missing in that approach. And that's why we identify in a lot of existing mental health interventions. So in the future, we have a paper that's currently under review, is reporting this finding. And I'm more than happy to share the paper with you all when it gets accepted for publish. So I also want to, extend an invitation to all of you who might be interested in continuing this journey to support the student mental health with us. And, our goal is really to increase the mental health awareness and address the inequity issues. So thank you all for your time and attention today. And if you have any comments, feel free to leave it to our team's website or email me, or I welcome for any feedback or comment now. Thank you so much.